introduce our speaker today, who is Ayodola Anise. Excuse me if I pronounce wrong. Is Anise or Anise?
Anise.
Anise, okay.
Mhm.
Great. So Ayodola is, I was checking her career and I was really impressed by the fast and steady grow in her career. So she has a master in health science from Johns Hopkins. She's a super top school. And then she became working with several programs. She was a program officer for PICORI. Then she worked for the National Academy of Medicine. She was a deputy director of the Medicine Leadership Consortium. And now she's the senior director of operation of Milken Institute of Health. So this is very impressive, and it's going to be really interesting because we are going to hear today from her. Let me, yeah. Okay, we're going to hear from her today about assessing meaningful community engagement. So this is something that we are really on in this area because the community engagement is a super important topic for our studies, for all our studies. And I think this is very important for all the connections that we make with patients and community in general. So how to make this connection is very, very impressive and very, very important. So without so much more introduction, I would like to present here Ayodola Anise, and welcome here to our series of seminar. The spot is all yours, and feel free to share your slides and your knowledge. Thank you.
Yes.
Thanks for coming.
Thank you so much for having me. It is a privilege to be able to share space with you and time with you on this day. And thank you for the kind introduction, and thank you to all of you for having me here. I'm just going to go ahead and share my slides. And while I do that, because it is definitely a process, a technical challenge. Let's see. Are you seeing my slides?
No, I see the Zoom, not the Zoom.
Okay. We practiced this before, I swear, and it worked.
Oh,
Let's try this one more time.
okay.
Okay, we're at the PowerPoint.
Okay.
Okay. Nice.
Perfect.
Yay! Well, thank you so much again for having me. I really appreciate the opportunity to be able to talk about something as meaningful and powerful and what I like to call both hard work and heart work, which is around community engagement and specifically measuring what matters. I think we all know that there is a huge benefit to community engagement. And there's so many resources out there that talk about the how. But one of the things that I've been blessed to be able to do over the past few years is to talk about the impact piece of it. So I already said thank you for having me, but I have to go on a little bit of a thank you tour because I have to thank the National Academy of Medicine Leadership Consortium. I had the privilege of being there for some time and working on this, as well as to thank the Robert Wood Johnson Foundation and the California Healthcare Foundation for their contributions to make this work possible. And again, thank you for your time, because time is a valuable, unrenewable resource. And I'm just grateful that you chose to spend it here with me talking about measuring community engagement. So I just want to start by sharing a little bit of background on the National Academy of Medicine, which was founded in 1970. And the NAM has a mission of improve for all by advancing science, accelerating health equity, and providing an independent, authoritative, and trusted advice nationally and globally. Um, Part of the work of the Leadership Consortium is really around making sure that there is stakeholder alignment. And the Leadership Consortium sees that as really critical in order to ensure that there is effectiveness, efficiency, and equity. And so you see on this slide the charter for the Leadership Consortium, and it really emphasizes that as we are doing this work and making sure that we have a health system that is learning, part of what is really important is that individuals and families are engaged, active participants in all elements. So I just want to underscore that so that you understand why this work is being done and sits within the National Academy of Medicine in the Leadership Consortium. The other thing that I should say is because I cannot see you all on my screen, but if you do have any questions or comments as I'm going through this, I welcome you to interrupt. This can also be a little bit more of a conversation and a dialogue. I'm very open to that. But when we talk about assessing meaningful community engagement, this is where the National Academy of Medicine comes in. And before I go any further, I do want to just talk a little bit about some important definitions, just so that we can all be on the same page. We worked on this effort with an organizing committee of 34 people, and I will introduce you to them shortly. But we wanted to make sure that as we were talking about community, meaningful engagement, that we were all on the same page about what that could mean. And so I start here by just sharing a few definitions. So when we thought about community, we wanted it to be as broad as possible. So groups of people that are affiliated in a range of ways. So that could be geographic proximity, it could be an online community, it could be by race, ethnicity, by focus on a particular condition. It could be even a community of multi-stakeholder groups who are working to improve equity, right? So we take a very broad approach to thinking about community. And then when we think about community engagement, we recognize that we are talking about a term that may not really reach everybody, but we see it as an umbrella term under which many things fall. So there's consumer engagement, there's patient engagement, there's caregiver engagement, especially when we're talking about conditions that impact the brain and brain health, right? So caregiver engagement is really important. There's civic engagement, there's stakeholder engagement. And so as I talk about community engagement, please recognize that I'm using a very broad umbrella term under which many things fall. And then, when we're talking about meaningful community engagement, we're really talking about a powerful view bringing about environmental and behavioral changes that improve the health of a community and its members. It involves partnerships, coalitions that mobilize resources, that influence systems, change relationships, and catalyze and serve as a catalyst for changing policies, programs, and practices. The crux of this for us is that meaningful engagement only happens when it leads to lasting tectonic shifts in resources, systems, relationships, policies, programs, and practices, right? So we want to see change. If we're not leaving change, then I think that we have to really question whether or not we're having an impact. A little bit about my background was shared earlier, and I had the privilege of working at the Patient-Centered Outcomes Research Institute, or PCORI, for about 7 years. And I do very wholeheartedly believe in patient engagement. If we're not already patients, we'll be patients. If we're not already caregivers, we will be caregivers. And so it's important that the system really reflect what we need and what we value, and take that into consideration. And so I had the opportunity to work with a research team. And if you don't have much background on the Patient-Centered Outcomes Research Institute, or PCORI, the funding agency that was developed with the notion of ensuring that patients are engaged as partners through all aspects of the research process. And it was authorized in 2010 as part of the Affordable Care Act. And many of the researchers that we worked with had never really engaged patients as partners. And so I was working with a team, and they were working on an intervention for parents of kids with asthma. And so when they applied to us, they developed their research questions, developed their interventions, identified their health outcomes, and then they got funding from us. And so they started engaging with their patients, their parents, um, and they said to the parents, well, we want to take a look at asthma. And so, we want to get a little closer to you and understand, what our perspectives are. And so they had everybody on the research team and the parent partners take pictures of what asthma looked like. And the research team took pictures of their cars sitting in traffic, of all the smog and, the people waiting at the bus stop. But the parents actually took pictures of themselves sitting at the bus stop. And so there's a difference in perspective, and engagement allows you to understand all the perspectives that are valuable. The same research team said, okay, we want to do a texting intervention to provide key information to parents of kids with asthma. When the parents were involved, the parents said, well, we don't want a text-heavy intervention. We're on all day. We want to get insights from people who look like us. Who can give us information that will help us to manage our child's asthma. And so what that meant was the team had an opportunity to really ensure that what they were developing from the research standpoint aligned with what the parents and the kids with asthma really needed. And this supported the uptake of the intervention. And so oftentimes when we're talking about engagement, there's a question of how do we engage? And for this project, we intentionally didn't start there because we know that there are resources that exist, and I'm happy to point you in that direction. You are interested in talking a little bit more about the how to engage, because that's also really critical. But we wanted to give people an understanding of what is really happening when you engage. What is the impact, right? Authentic and sustainable community engagement is integral to advancing health equity and eradicating barriers, but we need to make sure that there are measurement practices available so that people can understand that engagement is happening and the impact of that engagement. That was really the reason that we started this project. So the goal of this project was to build a menu of effective evidence-based engaged indicators and metrics that could be used to measure meaningful community engagement. Wanted to make sure that the tools that we created would be able to be used by individuals, families, and community groups in a wide range of settings, and I'll talk a little bit more about that. That they could be used to characterize, track, motivate, and guide progress in terms of engagement, and to shape how health and healthcare programs and policies are developed, implemented, and overseen. And that there was also an emphasis on the communities and the population that have the most need. And so, in other words, we believe that the fundamental question that we should be asking is not whether entities think that they are engaging communities, but whether the communities themselves feel engaged. And so I want to double click on what I said earlier, where it's only meaningful community engagement if the people who you are engaging say it is. And so with our organizing committee had a conversation about who the audience for this work was going to be. It's very much in the research space. We know community-based participatory research has really had a huge influence on how research is conducted. But we also wanted to make sure that the folks who could use this work weren't just and academic institutions, but a wide range of folks. And so we wanted to make sure that federal, state, local agencies, territories, and tribal communities could use this work. Community-based groups and community members could have access to it. Patients and advocacy organizations could use it. Funders and philanthropic organizations or other investors, healthcare systems, centers and hospitals, payers, plans, and industry, and systems that end up impacting health outcomes even tangentially. And so those would be things like housing, transportation, education. Not only were we taking a wide look at community engagement, but we were also looking at a wide audiences who would benefit from this work and could use it to influence health outcomes. So I promised that I would share with you about our organizing committee. This is the group of people who have really been shepherding this work along the way. You see 34 smiling faces that represent community leaders, researchers, designers, human-centered designers, policy experts, and they also are diverse in terms of geography, race, ethnicity, nationality, ability status, sexual orientation, and gender identity. I'll share with you a little bit about some of the lessons that we learned along the way, just so that you realize that even as I'm talking about this work, we had to grow and learn ourselves. And that started with our organizing committee. But one of the things that I want to highlight is that there is a square at the bottom right-hand corner of this slide. Anybody who uses these materials, who wants to join us on the process and journey of measuring community engagement, you have a place. Your face goes there. All right. So as the organizing committee started thinking about this work, and I should share with you that this all started in 2019. So we're 6 years in, and we are still working to make sure that all of the resources are available. So we wanted to make sure that we had a really thoughtful approach and a foundational strategy for how we were thinking about measuring engagement. I won't go through all of the things that are on this slide, and I'm happy to come back to it if somebody has a question. But I want to highlight a few things. The first thing that I'll highlight is number one on this slide. We were not trying to identify the ideal scenarios of what metrics were available for engagement. And what I mean by that is we weren't looking at the literature as our starting point. We were starting by engaging and talking to community leaders and other stakeholder leaders to think about what we should ideally be measuring for community engagement. We also make sure that what we were producing would be flexible. We wanted it to be able to be used by a range of stakeholders, regardless of where they sat. And so we knew we needed some that would be able to align with that. And then we wanted to make sure that we emphasized equity in the process as well as in our outcomes. That was also something that was important to us. And so together with our organizing committee, again, over the past 6 years, we have been generating a number of resources. And so I'm going to talk with you today about a handful of them. But one of them is our conceptual model. And the conceptual model presents the dynamic relationship between community engagement and outcomes. I can't wait to share the model with you. The second resource that we have are our impact stories. And these demonstrate how groups have engaged their communities and the outcomes they have observed. It was really important to us to do some storytelling because we believe that stories are a great way to connect with people and to share the range of ways that engagement has taken place and the impacts. The third resource that we produced were assessment instruments. And these are instruments and questions that have been used in different contexts and different communities to measure or assess engagement. These three resources are available on our website. So number 4, we have a website. And then there is also a user guide that is on our website that provides some guidance on how you can use these tools to be able to start to measure engagement. What we are now working on is what we call a National Academy of Medicine special publication. If you're familiar with the National Academy of Medicine, Science, Engineering, and Medicine, you know that we produce a lot of reports that are really revered by the science community, the policy community. And so it's important that not only are these resources and the process that we use to get here made available on the website, but that it's also made available in a report that people can cite so that we can talk about from an authoritative standpoint, from a trusted standpoint, that there is a need for measuring engagement. And so we're excited to be able to, in the next year or two, release the special publication that documents all of the steps. All right. So I shared earlier that we learned some lessons along the way. And I want to take just a little bit of time to talk through what we learned, because I don't want you to think that we started out knowing exactly what to do and everything worked out perfectly, because that was not the case. So I'll highlight a few things, and in the interest of time, I'm also going to speed things up a little bit. But we started with a committee of 15 people. Of the 15, 4 were community leaders. And it was important for us to kind of have a little bit of a reckoning to say, we're talking about measuring meaningful community engagement. 4 out of 15 community leaders is not really going to help us to understand what's going on. And so we actually increased the size of the committee to 34 people, and over half of community leaders, right? And so that, and you saw the 34 people on the previous slide, right? Timeline and resources. This is another, I think anytime you're doing community engagement, increase your timeline and increase your resources. This project was really supposed to be an 18-month project where we had 2 public meetings and we did a report. In the previous slide I showed you, I've said, this is 6 years and still ongoing. We have resources and are still working on a report. So things have really shifted, and in large part because of our engagement with community leaders. Okay, so I'm going to walk you through 3 of the resources. One of them is the conceptual model. So we started this work, and we felt like it was important for it to be grounded. And so we started reviewing the existing frameworks in the literature that our organizing committee had access to. Ultimately, what we realized is that we needed a conceptual model that was dynamic and that could communicate the relationship between meaningful community engagement and improved health and healthcare outcomes. So we worked, a full committee came up with a couple of boxes and arrows as a starting point for our framework, but quickly realized that we needed something that was different and unique. And so we worked with 11 of our community leaders to guide the process. And before we had many conversations, and there were a few key themes that came up. One is that we needed to focus on power and inclusion. And they said, we're not here to rubber stamp something, right? So what we produced had to be reflective of their experience. We also recognized that language matters. So word choice matters. Whose language? And so we needed to align there. And then we wanted to make sure that we were creating some enduring value, something that needs to accumulate in the community in terms of infrastructure capacity, leaders, right? Where is that investment? So we were listening to them, and these were some of the things that we heard. We worked with a human-centered designer, and so shout out to Kim Irwin and her colleagues who helped us to develop this. But we went through several prototypes, and so you see them on this slide. And before we got to prototype number 6, what you see is that the process of engagement was separate from the outcomes, right? Anytime we were looking at the process, it was over here, and we were looking at outcomes, the outcomes were over here. When we got to the 6th image, that was really where we had an aha moment, right? We were centering engagement in the middle, and anything outcome related flowed from that. So that was, I think, a real kind of lightning bolt of a moment. So I want to walk you through the conceptual model now. The final conceptual model centered engagement. So here you see engagement as the linchpin or central focus of the conceptual model. And so in the community, it represents both the start and the hub of movement towards outcomes. Then we built on meaningful practices. And so surrounding community engagement are the principles that the organizing committee thought should underscore the engagement practice. And so we developed core principles. This was also a very iterative process, and came up with the core principles that you see: trust, bidirectional in nature, inclusive, culturally centered, equitably financed. And one of the things that we discussed with our organizing committee is the importance of language, and that it's important for partnerships to come together and to define what these principles mean to them. And one key example that I'll give you is this notion of co-equal, right? If you are working in a collaborative partnership, and you have patient and caregiver partners, you have your researchers, you maybe have a payer involved, it doesn't mean that everybody's working 50-50, right? But there's agreement on what the roles are that each group will take on, and agreement about how to move forward. And so again, that language piece is really important, and everybody needs to be aligned and speaking the same language. So then we wanted to identify key domains of influence. And so here in this dynamic model, you see the domains that of influence for community engagement. So we have 4 domains and a total of 19 indicators. And so if you like flowers, you can call these petals. If you like engines, you can think of these more as propellers. But once we have community engagement and the core principles, we start with strengthened partnerships and alliances. And so things like trust, shared power and relationships, acknowledgement and recognition are really key. Once you have strengthened partnerships and alliances, then you can really start to understand what the expanded knowledge is. What are the new curricula strategies and tools that are being developed? What is bidirectional learning looking like? What community-ready information and resources are now available because you've built trust and developed these partnerships over time, and can think about knowledge in a very different way. Once you have that expanded knowledge, you're then able to move to the third area, which is improved health and healthcare programs and policies. You're able to develop community-aligned solutions, actionable and implementable and recognized solutions, and sustainable solutions, because you have the input and trust of the community. And then when you're able to do that, you can move to thriving communities, right? You're not just serving a small population with your program or your policy, you're able to now think more broadly about whole communities and taking into account things like physical and mental health, community capacity and connectivity, community power and resiliency, and life quality and well-being. I'll share as a fun fact that we started out with over 70 outcomes, and we're able to get it down to 19 over these 4 domains. And so I cannot emphasize that a lot of work went into this. All right, and so here you see the final conceptual model where we incorporated real world drivers and cycles of change. So when you're able to have community engagement centered as the linchpin, you have your core principles, you move through strengthened partnerships and alliances, expanded knowledge, improved health and healthcare programs and policies to thriving communities. We believe that you're able to get to health equity through transformed systems for health, because now you're transforming the systems. I will say that we recognize that much of the work that's taking place is done within a particular environmental context. And so we take into account drivers of health, drivers of change in health and healthcare, and social, political, racial, economic, historical, mental context, which you see around the image. And we recognize that if meaningful is taking place, that we can also drive changes in health, drive changes in health and healthcare, and changes in our environmental context. So this has a little bit of a flow to it. And so I'm just flipping through so that you can see what that looks like. I love doing that. But we wanted the model to be dynamic. And so hopefully that's what you're seeing here. I mentioned earlier that we wanted it to be flexible. So we wanted stakeholders to focus on what matters most to them in their partnership and the role that engagement plays. And so our aim isn't for people to be able to measure all of these things, but to start someplace, to start with, two core principles, to start thinking about a handful of the domains and the indicators. And we also provide some guidance in terms of how to use the conceptual model. It can be used to help spark a conversation and create some shared language on community engagement. The model can be used to meet community engagement needs. And it also ties to the impact stories and the assessment instruments that I'm going to share with you in a little bit. All right, so let me stop to see if there are any questions or if I can continue on to the impact stories. Okay, let me keep going. So for the impact stories, let's see. Oh, okay, there we go. We wanted to make sure that people understood that measuring engagement was possible. And so we wanted to be able to share compelling illustrations, experiences, and approaches that demonstrate how to use, evaluate, or impact the impact for community engagement and how it inspired action. And so we wanted to make sure that as we were developing these impact stories, that they were accessible, authentic, and contextual. And so to be able to address the accessibility piece, we have videos. There are 2 amazing videos that were created with our human-centered designers. We pulled out quotes. We captured a range of stories. We also wanted to make sure that the stories were authentic. We didn't want to tokenize engagement and just make it seem like it happened, like we did engagement and that's it. but we actually wanted to talk about the components that to change, right? The challenges that people and groups and partnerships went through and how they were able to come out on the other side. We wanted to make sure that that there was a range of contexts that people could see themselves in. So we started out by identifying about 20 potential stories, and so we crowdsourced this with our organizing committee. And then we went through a process where we had, I believe, about 3 or 4 of the organizing committee members vote on each of the 20 potential stories using the criteria, like, is this accessible? Is this authentic? Is it compelling? And then based on the comments that we heard, we narrowed it down and got to 8 impact stories. I will say we had 8, but then we needed to actually remove 1. And so we are now here with 7 impact stories. You can see in terms of the geography that they take place all across the United States, from California, North Carolina, Rhode Island, Central Plains, to Los Angeles. And they address different community needs, right? So we have low income, African American and faith-based, rural, American and Alaska Natives, LGBTQ, Latinx, multi-ethnic communities. And then we also have diversity in terms of health focus. So one of them looked at the built environment, others looked at partnership development across health issues, substance abuse and treatment. So again, we wanted to just make sure that we had a diverse set of stories. I'll highlight just one of the stories. It Matters, impact story, and this is a story that describes a longstanding community and research partnership where they worked on building opioid awareness and treatment infrastructure in rural Colorado. And so for the impact story, we provided the project background. So we wanted to very succinctly and very quickly make sure that people understood the context that the project was taking place in. We pulled out the key engagement activities that they did, right? Things like investing in pre-project community relationships, doing grant writing, but in a participatory way, leveraging community-driven dissemination strategies. We also included some of the outcomes that came from the project. In this case, it was an increase in community awareness of resources and opioid use treatment, disorder treatments. And then we also mapped the story through the lens of the conceptual model. And so one of the things that you see here is that as we're talking about the core principles that are used by this particular story, this project, the core principles are in green. The indicators that they aligned with are in blue. And you can see that not all core principles are highlighted in green, not all indicators are in blue. And It Matters is more of an established partnership. They have been in existence and working together for over 20 years. And so if they are not even able to, nor should they, measure everything, they're just focused on a few core pieces. And so that's one of the things that we would also emphasize to anybody who's doing this work, is that it's not about trying to measure everything or focus on everything. It's about starting from a place and then building it over time. And so when we take a look at ways to use the impact stories, we hope that these will give partnerships an opportunity to review and reflect on stories that resonate with their community context and priorities. We hope that different partnerships can see themselves in some of these stories in some way. We hope that people will use these impact stories to identify gaps and opportunities in their own engagement. Right? So learn about what others have done in terms of engagement processes, practices, and outcomes. Identify lessons that you might learn and things that you might influence your own efforts, and create new engagement practices and outcomes. And then we also hope that people will create and share their own impact stories to guide and inspire others. All right, so the last resource that I want to talk about are the assessment instruments. And I must say that when I started giving talks about the conceptual model, and this was before we had done all the work to get to the assessment instruments, the question that kept on coming up was, where are the assessment instruments? What are the questions that I can use? And we had to tell people, hey, you have to wait, you have to wait. But now nobody has to wait. Everything is now available and in the public domain. And at the end of the slides, there's a website link, and I can even drop it in the chat once I'm finished presenting, where you can access all of this information. So the assessment instruments were really important because we wanted to be able to provide a set of measures that could be used to understand if the engagement that was taking place was meaningful and impactful. And so we really thought about a process that would allow us to sit at this intersection of community evidence, scientific evidence. And so I think that that's just a really unique way of thinking about things, right? And that is to say, community is really important. Community evidence, community engagement is really important, as well as science, and they're not antithetical to each other, right? They really do need to intersect, and they can intersect. And I don't know if I mentioned this at the beginning, but I will say that one of the things that did also shift in our thinking about how we were measuring and thinking about community engagement was that we started off by thinking that we were going to identify about 10 to 15 measures that would be suitable for different audiences. And we realized that that was not possible, right? If you've seen one community, you've seen one community. And so we wanted to instead think about this as a menu of options that people could choose from based on their community experience, based off of their community needs, instead of thinking that 10 or 15 would be able to be used by everyone. So that was a change in our thinking that I wanted to highlight before I go into our process here. So we did a literature review of various data, and we developed search terms that included engagement terms. So we had about 21 engagement terms, from citizen engagement, collaboration, community action, stakeholder, consumer participation, patient engagement, the list goes on. We looked at 17 terms for measurement, trying to get it in some way. So measures, indicators, assessment tools, evaluation mechanisms, metrics, performance, questionnaires, and then health. So community benefit, community health plan, policy. So we're really looking at what the literature says at the intersection of engagement, measurement, and health. And so we did this search, we started the search in 2019. We didn't have like a starting point, so we went back as far as we could. And then we did the search again to see what we might, what new articles may have come from 2019 to 2021. If anybody wants to update this search, let me know, because it would be really, to use a technical term, cool to see what new surveys and literature or supporting literature is available for the tools that we have here. All right, so we, based on that, the search terms, ended up with 1,471 articles. So this came from the literature search, and then we did also do a search of the gray literature. I will say I read through all of the abstracts, and we had inclusion-exclusion criteria, because what we were looking for was articles that reflected engagement in some way with measures and in the health space. And so from there, we were able to down to about 369 articles. And the team read through all 369 articles so that we could better understand what was going on in those, in the full text. So some of the things that we ended up seeing that we excluded, things like doctor-patient communication came up. Something might have said measure, but they didn't actually have um, an instrument or a set of measures or tools that we could pull out. We didn't include it. And so we then, from there, were able to get to 82 articles that met our inclusion criteria. And those 82 articles represented about 112 instruments. And so we thought, okay, we have 112 instruments. That's still way too many, right? How could we go to a community or policymakers or researchers or anybody and say, here, choose from 112? That's really not a menu of options. And so we went a step further and identified a set of prioritization criteria, which I'll share with you in a second. But that allowed us to go from 82 articles to 37 articles. And that allowed us to go from 112 instruments to 28 instruments. And so we felt like that was a little bit more manageable. So how did we get to those 28 instruments? We wanted to prioritize effective evidence-based and community-engaged instruments that support the process of assessing community engagement. And so we had a subset of our organizing committee help us to refine the instruments. And so we created 2 criteria, and we felt like the articles must mention community engagement in the development, implementation, or evaluation of the instrument, and that the instruments must show validity or reliability testing, right? And so for us, this was really what allowed us to sit at this intersection of community engaged, community evidence, and evidence-based science. And that allowed us to get to 28 instruments. And so these instruments were developed, used, or implemented in the US, Canada, and a few other countries. 3 of the instruments were translated into Spanish, and 6 are available in other languages. And so we wanted to be able to present them in a way that anybody could use them. And so some of the communities that are reflected, so not just community and academic institutions. We had 6 instruments that actually were used by community and academic institutions. We had 4 that were developed by, with, or for communities and hospitals, clinics, or health systems. And then we had 2 that were developed by, with, or for community and government agencies, right? So you see that, back to one of my earlier slides where we wanted to make sure that there were a range of audiences that could use these tools, that these tools actually were developed by a range of different audiences. So we were able to meet that goal that we had. So just to give you a little bit more context for those 28 instruments, I will say we didn't just say, here are the 28 instruments and, everybody, go and measure engagement. We actually did a lot to look at the instruments, the 28 instruments, and all of the questions that were in those 28 instruments. And so we added it up. We looked at over 1,000 questions, 1,000 individual questions. And then we mapped all of the back to the conceptual model. And one of the reasons that we did that was because we wanted to make it easy as possible for people to be able to see what mattered to them. If trust mattered to you, we wanted you to be able to see, here are all the questions that get at trust. If shared power mattered to you, we wanted you to see all the questions that get at shared power. And so that meant that we needed to do some of the legwork in support of the range of audiences. This doesn't preclude other people from doing it, right? And we recognize that this is our perception. That said, we had 2 team members review each question, and spent a number of hours having conversation around where we should place certain questions and align it to the conceptual model. So of the over 1,000 questions, you can see that about 76% of them fell into the category on the conceptual model that focused on strengthened partnerships and alliances. And then you had 5% in both expanded knowledge and improved health and healthcare programs and policies, and then 9% in the thriving communities. This actually didn't surprise us, right? A lot of work has been done in terms of partnerships and alliances and thinking about the qualities and the questions that should be used to get at that. Where there are opportunities for growth in terms of measure development is really in the other 3 areas. So we didn't stop there. There is more. So we wanted to make it easy for anyone who were using these tools. So not only did we map each of the questions to the conceptual model, but we also created instrument summaries to support assessing community engagement, right? Not everybody has access to the literature. Not everybody wants to go to the literature and read, 10 articles on something. And so what we did was we synthesized all of the information that was available on the 28 instruments that we found. So if you go to our website, you'll be able to pull up a summary for any of the instruments, and you can search by alphabetical order, by how many are aligned with most of the conceptual model, by the name of the tool if you want, or by the domains, right? So we tried to make this as simple as possible, but we also tried to make it so that nobody had to go back to the literature. So on the left-hand side of all of the summaries, you have the key features of the instrument. So what community or geographic region did it take place in? What were the community engagement outcomes that aligned with the conceptual model? Where was the instrument used? Was it used in the hospital or a community setting or an academic setting? And then what language translations are available, if any? What psychometric properties were done, and then the year of use. So that's on the left-hand side. At the top of all the summaries are the citations. So all of the citations that we found where this instrument was referenced. We have an overview of the instrument, alignment with the conceptual model. And like I said, all the questions were mapped to the conceptual model. So you'll be able to see what domains and indicators aligned. And then we also included a brief description of the instrument, how it was developed, implemented, or evaluated, information on the populations that were engaged in using the instrument. And then we had additional notes, such as what limitations were mentioned in the articles, what were the findings, if they were doing an intervention, what did it say about the outcome, and then if the article highlighted future research that was needed. We summarized all of that. And then just to give you an example, so under strengthened partnerships and alliances, one of the indicators is diversity and inclusivity. And so I pulled this from one of the instruments, and there's one question. This is just one question out of maybe tens or more. In your opinion, does your coalition have sufficient representation from groups, organizations, and/or schools in your community to accomplish the objectives of the coalition? Right, and it goes back to what I said earlier, right? It's not really meaningful community engagement if you are not asking the community how they feel about that engagement. And this is a question that does that very nicely. Of the 28 instruments, we have 3 instruments that cover all 4 of the domains and cover most of the 19 indicators, right? So as I mentioned, when we developed the conceptual model, we did not do it from a place of what is already in existence in the literature. We did it from a place of what is the ideal. And so to then go to the literature and see what aligns, like this is, in our mind, something that we are excited about. So the instrument that you see mentioned on the far left, the Community Engagement Survey, has such a high coverage of the domains. And so it aligns with 15 of the 19 indicators. The Partnership Self-Assessment Tool also aligns with 15 of the 19 indicators. And then the capacity building in residential areas aligns with 14 indicators. As I mentioned, on our website, you can navigate and explore the instruments and the summaries based off of what matters most to you. So you could do so by alphabetical order, most coverage of the conceptual model, which I just covered, the conceptual model domain alignment, the place where the instrument was used, the language translation, or the psychometric properties. So you have a variety of ways of starting to think about the tools and the questions that might be most beneficial to the work that you're doing. Okay, so how can you use the assessment instruments? You can engage in community inclusive and rigorous measurement, seek out the questions around how your community engagement is working and how to improve it. One of the recommendations that we have, and this was validated in the conversations that I've had with groups who've been using this, is that they actually talk to their partners and say, what are the things that we want to measure? What are the things that we're curious about and that we want to know more about? And they kind of collate what comes from the group, and then they say, okay, let's see what instruments talk through the things that we're most interested in. And then they kind of work with the group to say, here are a list of questions that we could start to ask. And so that is an option that is available. So you can determine which instruments, the names and indicators that are of interest to you. You can review and compare the questions that you want to use. And also think about what are the qualitative questions that you might want to ask in support of these questions. You can also use the instruments to help community and scientific evidence, right? You can use the questions exactly as they're worded in the instruments and then compare it to the data that's available from the literature. But you can also modify the questions, right? Or combine them, questions from multiple instruments, so that you can pick and choose and match what makes sense based on the community context and interests. And then you can use this as a starting point and even create new questions so that you can make sure you're meeting your community and engagement needs. And then you're able to adapt the conceptual model visually to identify and align with what you're measuring. So we encourage people to use the suite of resources. Depending on the stage of community engagement that you're at, it could mean that you're just starting with the conceptual model. You're just starting with defining the principles that matter most to the group and identifying what you want your partnership to address or assess. It could be that you're at a stage where you're doing that and to think about the stories that you want to tell and how people can understand the impact that you're having. And then you may be at a point where you can start to measure the engagement and look at the instruments that are available to you and that have in similar contexts and communities. And you can start to explore the questions that will help to understand if your partnership is doing what it set out to do in a way that is meaningful. So these tools are flexible. These tools are, available to you. We're not suggesting that everybody try to do it all, but to start and to take small steps in moving community engagement forward. This is one of my favorite quotes in terms of thinking about the way forward by Goethe. Knowing is not enough, we must apply. Willing is not enough, we must do. And so in terms of the way forward, we hope that you're able to use these resources to improve, to think about how to improve engagement, how to understand the impact that the process of engagement is having, and how to measure progress towards transformation and health equity. Shifting towards meaningful community engagement often requires decision makers to defer to communities and to move to power sharing and equitable transformation, which are all necessary elements to ensure that we have sustainable change that improves health and well-being. And so I encourage all of you to think about what you must do to apply and what you must do. Thank you, and I'm looking forward to some good conversation. Here's the link to the website. My email address is here, and I also have included the email address for my colleague, Asia Williams, still at the National Academy of Medicine. And if you have any questions too, you can also email the Leadership Consortium at nas.edu with the subject line Measure Engagement. So let me stop there.
You're muted, Dr. Nate. Oh, Dr. Nate, you're muted.
Hey, thank you, Mira. Well, thank you, Ayodola. This was a great presentation and very interesting, very pertinent to the work we do here and to some work that we are doing and that we will be doing in the future. Now, every day we get more requests in grant applications about how do we measure the impact of in the community. So this is definitely a super useful tool that you are sharing here, and well, the insights and how you structure this was amazing. So I would like to open the floor to our audience here. If anybody has questions for Ayodola, this is a very good time. I would say, would you be able to copy the link and put on the chat? Because okay, the link is there in the. Let me see.
Yes, I can do that.
Yeah, that would be really useful. So, okay, Carmen, you are here. Thank you. You're muted, still muted.
Thank you very much. That was a very interesting presentation. I've been thinking a lot about this issue of measurement, making sure that we understand the impact of community engagement. And at the same time, I feel community engagement in some ways is a resistance to Western paradigms that, focus on perfectionism, and that includes objective measurement. And so how have you dealt with that tension of wanting to objectify or objectively measure something that in many ways has been hurtful to translational research by not including lived experience, different sources of knowledge, and things that quite honestly are difficult to measure, like trust.
Thank you for that question. I think that I'll start by saying everyone who worked on this project was very aware of the importance of engagement, right? To know that the only way that we can really improve health and well-being is to move out of that kind of, as you said, Western paradigm. And so for us, it wasn't about it was about both and. And so, when you take a look even at the organizing committee, not only did we have community leaders, but we had academic researchers who were grounded in community-based participatory research, right? And so I will say too, and this is one of the reasons why I talked a little bit about the experience of being at the National Academy of Medicine, which is a very scientifically rigorous group, right? And thinking very differently about how we were engaging our organizing committee members, right? And recognizing that there were going to need to be shifts in our academic framing and thinking, right? And so we went from 2 meetings, 15 measures to something that looked very different, right? And so I would say that it was really about respecting both the scientific evidence and the community evidence. And when we made sure that we were operating in that way through all of the steps, that's what allowed us to get to where we are and to still have engagement from, I'd say, the majority of the organizing committee, even though we are 6 years in, right? And so I think we also recognize that engagement takes time, and the development of resources that supports that engagement takes time. I hope that answers your question.
Yes, thank you. I appreciate you saying it's not about either or, but in both. Yeah.
Super interesting. Anybody else having questions? Well, I have some questions, of course. So I was trying to get here to those to the resources that you share here. Okay, there is the sustainability journey map, but how do we get to those models of that you explain there? Let me see if they are resources. Oh, are they on directly on the publications, or are they accessible from publications, or do you have a site where they are all mapped?
So the instruments themselves.
Yeah, the instruments.
Yes. Let me see if I can maybe share my screen and I can navigate through to it for you, if that would be helpful.
Definitely, yes, because we want to use them for sure.
Okay. Technology is not my strong suit, so let's see. Okay, I'm going to share my screen. Okay, so this should be the page that you see when you
Okay, yeah.
And they did redesign this page, and so unfortunately you have to kind of scroll all the way down to get to the resources to help measure community engagement. And if you click on the conceptual model, it'll take you to I'll click on it. So it'll take you to a full image of the conceptual model, and it will take you where it will like break down all of the definitions. I mean, we were very intentional about making sure that we, like, how are we defining this? When we say partnerships and opportunities, what does that mean? What does that look like? And so you can see all of that here.
Okay, yeah, and the previous link on the assessment instrument is where they are. Actually. Okay,
Yes.
hello.
So
Oh my goodness.
Yes. And so if you wanted to, you can, if you scroll down where it says explore the instruments and summaries, you can download all 28 as one PDF.
Wow.
So you'll be able to see that. But if you wanted to sort, let's say you wanted to see 8 in alphabetical order, here they are. Let me go to this one.
Wow, you have also psychometric properties of them.
Yes.
Validation, reliability. Wow, that's
This was a lot of work.
have done. Yeah, this is a huge work. Yeah, definitely.
Yeah, and so you have the citations for the articles that we pulled from, that we created the summary from. So if you wanted to go back to the literature, you could. Here it gives you the overview, right? So this tool has 140 questions, and it was used by community coalitions. You'll see how it aligns to the conceptual model. So you can see this is a tool that is, really heavily focused on strengthened partnerships and alliances. And then each of the questions is mapped to the conceptual model and the domains. So you can say, okay, which question, I'm interested in diversity and inclusivity. What might I want to think about asking? And you can see here the questions. And like I said, you can modify them. You can use it as is. You can use this as a starting point to create a brand new question if you wanted to.
Yeah.
And then if you scroll down further, you have background on the assessment instrument. So what was the context that it was used in? A further description of the instrument, what engagement took place. And this is one of the places where the literature was lacking, because it didn't always talk about or give a lot of detail around the engagement that was used in developing, implementing, or evaluating the instrument. But where it did, we pulled it out because we felt like that was valuable. Limitations, findings, and then any supplemental information. So as I mentioned, you don't have to go back to the literature unless you want to.
I see some of these are already translated into Spanish too.
Yes, actually, I believe available language translations is one of the options. So there are 3 tools that were translated into Spanish, and then you have a few other languages that are available here. So if that was your starting point, you could start with these 3.
Well, we will be contacting you back to get more information on this, and definitely very useful presentation, very useful information. This is a toolbox that is going to have a lot of resonance here for sure. Okay, anybody else has any questions, any consultations? Well, we will keep you busy, Ayodola. Very soon.
Please reach out if you have any questions, and I can even help navigate through this with you, some of the instruments, and I am happy to. Like I said in the beginning, this is both hard work and work, and it takes all of it.
Yeah, well, definitely this was great. I would like to say thank you again to Ayodola Anise for the time. This is precious time, precious knowledge that you share here with us, definitely. So this is great. Thank you very much. And here are the announcements for June. Okay, we will have our next seminar on June 17th. Dr. Chakraborty is going to be about disparities in urban heat hazard and exposure. Very important here where we are. It's so hot. And there is a request for application. The deadline is July 15 for TARC. If you need any more information, please contact us. We have the information. And there is a new release from the Alzheimer's Association, Facts and Figures, that, well, it's a little bit difficult to go here on this, but you can contact us for further information. Thank you again, everybody, for being with us today, and have a very good evening. Thank you, Ayodola. Appreciate so much your expertise. This was really awesome. Really,
Yeah.
awesome. Thank you so much. Really.
Thank you so much.
you.
My pleasure.
Hey,
Take care.
see you again soon. Bye. Bye, everyone.